Сайн байцгаана уу хүнд үзэгчдээ. Өнөөдөр манай de facto нэвтрүүлгийн зочноор Жонс Хопкинс их сургуулийн анагаах ухааны дэд профессор ноён Mohamed Atta оролцож байна. Good evening.
Good evening.
Welcome to Mongolia. Welcome to my show.
Thank you. Thank you.
Please tell us about your visit. What was the purpose? How many times?
This is my third time actually visiting Mongolia. I came 3 years in a row. It is part of the International Society of Nephrology educational program. So the International Society of Nephrology is a global organization that has publication but also provide a lot of educational support for areas that need education. And one of these programs, it's called the Ambassador Program, where actually some of the hospitals around the globe that thinks that they are underserved and they need some support, they ask the International Society of Nephrology to provide them with some of the educational ambassador to come to the country and help. So this is really my third time. I came 3 years ago, and I was excited by the reception and the young group of nephrologists that I met at the Second State Hospital that made me feel that they are really hungry for education and learning, and they are asking for more every time to actually help the society and increase awareness of kidney disease in the country, because it is obviously a silent disorder. So a lot of people may have kidney disease and may not be aware of it. It is a global epidemic, kidney disease in general, and that's one of the efforts that the International Society of Nephrology tried to increase awareness as well across the globe.
Okay. Then let's talk about this, you said that silent disorder, the kidney diseases. And in Mongolia, please describe how bad or average is the situation in Mongolia with kidney disease so far. What is your finding?
Sure. So there is no national data to speak of. The last national data that I looked at from Mongolia comes from 2009, where the prevalence of kidney disease in Mongolia is estimated at 18% of the population.
1/8?
Yes. So if you think about it, and even actually across the globe, if you look at any country, the prevalence of kidney disease will range between 11 and 13%. So if it's 18%, and this is as of 2008, that's probably higher than the average.
Two questions. Why we don't have that database? Why? The people have disease, they go to hospitals. How come that we don't have this database?
Sure. Well, I think part of it, it's a national effort rather than really a hospital effort. It has to come from the national driven data rather than hospital-driven data.
All right. So at the national level, we are ignoring, or we are kind of missing these points, because statistics are so important.
Sure.
Because without them, we cannot see the trend.
Absolutely.
We cannot know where we can focus. Where is the origin of the disease, etc. Right?
Right.
Second issue, you just said that it's just striking for me. The world is up to 12, 13%. Mongolia is 18%, some 8 years ago. Why? What happened to Mongolians?
Yeah, it's surprising to me because when I think of Mongolia, I'm very interested in history because of my origin, and I mean, this was the biggest empire of mankind. I mean, and to see that really some of the basic needs for healthcare in this country is not really provided, it's really remarkable to me.
That's the bitterness we have.
Yes.
Once such a nation today, we even don't care of elementary diseases that are killing us.
Yes.
That's very worrying. That's why, that's still one of the reasons we would like to listen to you a lot. So, what happened? Why 18%?
So I think just based on my very little experience, just coming for a week every year, I think part of the problem is immunological disorder, which is really common in Asian countries in general. So what we call inflammation of the kidney that is really driven by immune stimulation. So the immune system is really stimulated and really attack the kidney. Diabetes on the rise, which is really a global problem, not just in Mongolia. And I think having patients with diabetes that is uncontrolled, it will lead to, in a lot of patients, to develop kidney disease. So those are the two main issues in Mongolia that I think of, that I've seen so far.
Okay, let's go one by one. You talked about the inflammation of kidney.
Yes.
And a lot of Asian countries have this immunological, immune to that.
Right.
Why?
So like, I'll give you an example. In Japan, the kids in school, they get screened in school for this immunological disorder, for kidney disease, because it's a very common. So all the kids in young age will be screened for these disorders.
Do we make it here?
I don't think so.
No, Mongolia, okay.
Right. I think one of the other issues that I think that people hear, since diagnosis is not complete in many ways, meaning that, like for instance, you need to complete the diagnosis, you need to do a kidney biopsy, for instance, and to do a kidney biopsy, you need a pathologist to read the biopsy. And there is no attention to the pathology side, which is really has to be specialized in kidney pathology rather than a general pathologist who actually read any pathology. Renal pathologists are very, very important for the reading of the kidney tissue. And then after all of that, you don't have the tools to actually, if you have a renal pathologist, you don't have electron microscope, which really is important for the final diagnosis for a kidney disease. It's amazing that in the 21st century we don't have electron microscope.
Hang on, you said in Mongolia we don't have complete diagnosis, which is very shameful, and in a way it kind of offensive to ordinary Mongolians that the whole country has not that, cannot make complete diagnosis because two things. One is not enough instruments, second, not enough doctors who can read and understand that. Let's go by the instruments. I understand there should be these tissues to be properly studied through microscopes. There are 3 microscopes, and out of 3 in the world existing and using, we have only 2 of them. The third is missing.
Correct.
Which is electron microscope, right?
Correct.
Why it's missing? Is it so expensive or what?
Well, I was talking with Dr. Abigail actually to do some fundraising. I'm sure there are a lot of businessmen or women in Mongolia that would care about the Mongolian people to actually have this electron microscope. It is kind of expensive. I mean, for ordinary person, I mean, it can be.
It's like a computer tomograph kind of.
It will be like $500,000 in that range. So it is expensive, but I think it's important, even if it's that expensive, I look at basic needs of human: food, housing, and health, right? So health is very key element in any person's life.
Understand.
And if you can't provide it as a country, you should actually find a way to have people to lobby.
First of all, this country, at least for 3 million people, 1 or 2 electron microscope for kidney tissues to see completely. Then we can complete at least the diagnosis first. Second, you said about the professionals.
Correct.
Do we have them?
We were successful this year to bring a renal pathologist from Hopkins as well to actually train some of the pathologists here at Second State Hospital at how to process the tissue and how to actually read the tissue properly. So this way, at least we have the first step. And this was also part of the International Society of Nephrology Ambassador Program, who brought the renal pathologist with me. So this way we can do the biopsy, read the tissue properly, and then we have another pathologist who can actually continue this process.
Only that means with this program, thanks to this program, only third year, within a week, we have professionals who can read this biopsy results.
Correct.
Where this biopsy have been microscoped?
So we take the tissue and the pathologist actually read it at the Second State Hospital.
But when you said take, from where?
From the patient.
From patient, but how then without electric microscope?
We don't have enough diagnosis. It's not complete diagnosis. We have the light microscope, we have the immunofluorescent, but we cannot really have the final step. So we have what we think the diagnosis is.
So that's the reason why we have this 18% is we don't have complete diagnosis in the country because we don't have instruments for enough and we have professors enough. We have to prepare that.
Sure.
Okay. Second issue you said about this immunological disorder is we talk about this comes from this diabetes. Diabetes rises. And have you seen any statistics about diabetics in Mongolia?
No.
Дэлхийн шилдэгүүдийг тодруулдаг Forbes сэтгүүлийн шилдгээр Luxury King Tower Apartment шалгарлаа.
So one of the possible reasons is diabetes. We talked about, and we are concerned about this diabetes raising in the country. Now, that's you and me talked about why we don't have statistics of these people who has kidneys. Now let's go to the issue of how to prevent kidney disease for ordinary people. What does cause this disease? Where we Mongolians are to be careful?
Yeah, so I think one of the, as you said, that you have obesity 10%, which is really a small figure compared to the United States, which goes to 30% or more. We think that we have in the US 35% of the people we consider obese or overweight. So 10%, but if we adopt the same lifestyle that really the Western have been adopting in the last decades, which is really not moving a lot and really eating fast food and stuff like that, that will lead eventually to increase the number of obese people from 10% to higher. So I think diabetes, in my mind, type 2 diabetes, because there are two types, type 1, which is really autoimmune, you cannot prevent because it's really immunological disorder, but the majority of diabetes are type 2, which is 90% of the cases. And type 2 diabetes, in my mind, is a curable disease. A lot of people may disagree with me about that, but I think really type 2 can be prevented, and if you prevent type 2 diabetes, that will lead to a significant reduction in kidney disease. So obviously, I tell my patients all the time who have diabetes or type 2 diabetes, if you walk, brisk walking 20 minutes a day, that will actually lead to a lot of healthy control of your diabetes, and at least in the initial phase of discovering type 2 diabetes, you can actually reverse course. And since we know that 20 to 30% of diabetic patients develop kidney disease, so that's really a very simple maneuver to actually tackle the issue of kidney disease.
So you tackle this diabetes, then you will more safe.
Absolutely.
In terms of kidney. Another common perception here is kidney is a lot associated with alcohol. Is it true?
Well, alcohol is more associated with liver disease rather than kidney disease. There are certain types of alcohol that may lead to not the regular alcohol that people drink, but really there are certain alcohol that can lead to kidney problems. Like some people drink antifreeze, for instance, which is alcohol. That can lead to kidney failure.
I see. Through liver, then that makes kidney.
No, the antifreeze itself, it's ethylene glycol. It's not really ethanol. It's a different form of alcohol. It's ethylene glycol, which can lead to kidney disease, acute kidney, and stone formation in the kidney.
Okay, so back to kidney, a lot, 30% probably of the causes you said, of course, approximately. 1/3 is associated with 2 types of diabetes.
Right.
What are the other causes?
So, no, I said 30% of the type 2 diabetics will develop kidney disease.
I see. Okay.
But it's really, we think that the most common cause of kidney disease in Mongolia, at least as of now, since we are biased because I biopsy a lot of patients when I come here, and most of the cases are immunological disorder, but that needs diagnosis and can be treated. But the diagnosis requires biopsy, and the biopsy
is not necessarily the faults of the patients.
Correct.
They may get it when even they don't know.
Correct.
And how late is late to discover that?
Well, if you don't have the specific diagnosis, and if you don't present to your physician to have this evaluated and have proper diagnosis, it may actually lead to scar. And scar mean like you get a wound and you get scarred, and if you get scar in the kidney, it's not reversible. It's not like the skin.
What subject does touch the kidney inside to make a scar?
So it's inflammation, like a lot of inflammatory cells that invade the kidney and actually will lead to damage. And the kidney is like a filter, right? So that filter can be leaky, and when it's leaky, it can lose actually a lot of protein in the urine. And with that, you get a lot of inflammatory cells that invade the kidney tissue, and with inflammation, you get the scar.
I see, that's one. Okay, see, people have this scar, or they have a sickness of kidney. What can we do? Can we treat completely, or if not, then can we transplant it, or just die?
Correct. So the most common immunological disorder in Asian countries is called Iga Nephropathy, Iga nephritis, which is really one of the antibody that is produced by our body that actually is attacking or deposited in the kidney. That's part of the immunological process. So that's the most common. The good news is that a lot of these patients actually, if diagnosed early, they can be monitored and they can live a normal life without really developing the abnormalities or the side effects of that disease, meaning that ending up on dialysis, for instance. So obviously not every patient present the same way, so it's IgA, that's the most common. But some of them have benign course, they don't need any intervention at all. Some of them have mild disease that will need a little bit of intervention. Some of them have very aggressive disease. And those are really the ones that require aggressive interventions. You can't leave them because they can end up on dialysis in a very short period of time. And therefore, you need early diagnosis, early intervention to know that this is aggressive form or not.
In kidney, they say viruses are C, D, etc. And now I understand Mongolia compared to 20 years ago, now we are more or less can treat that. Now we can get rid of the C viruses, for example. Are we doing it surely? Are we doing it well in Mongolia?
Yeah, so I saw 3 patients yesterday with hepatitis C, and I think none of them were treated. And some of them have the misconception that really treating them with the new drug for hepatitis C will actually affect their kidney disease, which I don't understand how they got this information from. So yes, the treatment for hepatitis C is very important because hepatitis C can affect the kidney, not the drug that treats hepatitis C.
Oh, I see.
Дэлхийн шилдэгүүдийг тодруулдаг Forbes сэтгүүлийн шилдгээр Luxury King Tower Apartment шалгарлаа.
So, how free are we in Mongolia from this hepatitis?
So I think the good news I heard actually that they have now the new drug, which is Harvoni, that treat hepatitis C, and this is really a very effective drug to eliminate the virus. And now by eliminating the virus, you eliminate kidney disease as well. You eliminate liver disease. It's not just the kidney, the liver, and the potential for malignancy in the liver in the future. So
the one we currently use, recently imported, are doing very well.
Absolutely.
It's the right one.
Absolutely.
Very good. It's a fair news for many people to understand that. Once you have this, say, this tissue scar, then if there is particular medicine, they should take it, or this is dialysis, or they go through this artificial circulation, right?
Right. So once you get to the point of no return, the point of no return meaning that really the kidney function is going to decline over time, and there are some medication to delay that decline, but not really prevent it. So the progression will be slow, but ultimately will lead to dialysis, and if you end up on dialysis, you need a transplant, which will be the cure, or not the cure, but at least the treatment.
How long this dialysis can survive?
So we have data, but not from Mongolia. We have data. Patients usually survive on dialysis on average about 6 years.
6 years,
which is obviously is very low for someone young. Transplant will be the ultimate because it actually can increase the lifespan to almost normal.
Yeah. So for people who has gone beyond no return point, as you said, dialysis may extend your life, but on the average in the world, 6 years. Mongolia probably a little bit less. But however, those who is on dialysis, must they have transplantation or not?
Everybody is eligible for transplant unless really they have a major problem.
Okay.
Should be eligible for transplant, should be evaluated for transplant.
Let's talk about transplantation in Mongolia. Is it possible? Do they make it? How good they perform it compared with, say, your school, your other countries?
Yeah, I only know that there is only one hospital that provides transplantation, and
in Mongolia.
Right, and I don't know really the data.
It's a number one hospital, number one probably.
Yeah. So
how many transplantation they have done so far?
I have no clue. I don't have that information.
Okay. Again, you said there is no statistics. That's the issue.
Right.
They have recently announced that they have been performing transplantation of kidneys, which otherwise people had to go abroad for and spend tons of money. But still they do. I think Mongolians spend per capita the largest amount of money abroad for medical treatment.
Which is a shame.
It's very shame, and we are very concerned. Now we have also so-called medical insurance.
Who doesn't pay.
Which doesn't pay anything, actually.
Yeah, and one of the concerns of the young nephrologists that really that patients on dialysis cannot actually get their medications because the medical insurance would not cover for it. The simple medication that are used for dialysis patients cannot be covered by insurance, which is another problem.
It's a very shameful problem.
Yeah.
And then the people ask, what the hell, I was paying all this money. If you get at least this dialysis, and plus this machine for circulation, making dialysis, I understand it's also not enough, and also some problem. There is a particular liquid they should go through,
right,
which is also imported.
Right, and they don't have. So there are two types of dialysis. One which is the hemodialysis, which is really through the blood circulation. But there is one that is called peritoneal dialysis, which is done through the peritoneal cavity, which is really through a solution rather than through the blood. And there are types that are done through a specific automated machine that is not here in Mongolia, because these are done during sleep time at home. So it's actually more convenient for patients who live
Instead
far
of
from the
going
city.
to a hospital, you do it when you are sleeping at home.
Yes.
Why we don't have that?
Yeah. So this is a very simple way of actually providing patients who come from far
Yes.
and who don't have the service in the city actually to
Have
do
you seen that in Mongolia?
Oh, it doesn't exist.
Doesn't exist. And is it what, especially expensive or?
I don't think so. I think it's really it's provided by companies, international companies, and can actually be shipped to Mongolia. I don't think
Yeah,
there
this,
is any.
it's very shameful. I mean, we don't have that electronic microscope. We don't have this dialysis machine that can be used at home. And I'm just wondering what these people are doing in this country. To the end of our interview, please tell us, Dr. Atta, you have been to other countries. Obviously, your international program is wonderful. And Mongolians, the people who particularly have this disease, benefiting from it, at least having a light on these issues where we must know, we must solve. Can you compare the situation with many other countries you have visited? Compare the situation of Mongolia.
It will not be fair. I tell you, most of the countries I've visited were actually very, very well run. They have very good infrastructure, healthcare wise. So it would be unfair actually to compare them to the system here, because there is a lot of deficiencies in the infrastructure here for healthcare that really need to be addressed on a national level rather than actually at the hospital levels.
You are originally from Egypt.
Correct.
You studied in the U.S. and now you're running a very important department of the #1 world medical university, Johns Hopkins is, and coming from Egypt and now visiting countries like Mongolia. What you would like to tell to people from all over the world about kidney disease?
I think people should pay attention to this epidemic. This is a global problem, it's not a Mongolian problem, and I think people need to take it seriously, and they should actually lobby to have the services that is required for diagnosis of this disease and treatment, and they should have that basic need, and they should discuss with the lawmakers in this country. They should really have business men and women who can actually help to address this issue. This is really a key element to healthcare here in this country.
People are to know importance of this. Second country is to have necessary equipment for complete diagnosis.
Sure.
The third, businesses to help to be more humane to your own society.
Absolutely.
We do. We should. Thank you very much.
Thank you so much.
Thank
I
you very
appreciate
much.
it. I appreciate it.
За хүн үзэгчдээ өнөөдөр манай дефактоны төлгийн зочноор энэ бөөрийн өвчний тухай онцгой ярилцлага хийлээ. Энийг одоо дэлхийн алдартай Жонс Хопкинс их сургуулийн эрүүл мэндийн сургуулийнхан дэд профессор Мохамед Атта оролцлоо. Их баярлалаа.